So today I want to talk about Osgood-Schlatter disease. First, I want to talk about what the disease actually is and the symptoms, and then I kind of want to get into how we diagnose and treat it in physical therapy. So Osgood-Schlatter disease is typically seen in young people going through a growth spurt. So typically that's females age 8 to 13 and males age 10 to 15. Now, you may not have heard of this disease, but it's actually relatively common. It's estimated that about 10% of people will experience some symptoms of Osgood-Schlatter between the ages of 12 and 15 years old. So what actually happens? We have what's called a patellar tendon. That connects your kneecap or your patella to your tibial tuberosity, the bone in the front. There's a little bit of a bump in the front of your leg, and there's a thick tendon that runs between there. What happens as we grow is our bones grow faster than our muscles, and so our muscles get tighter trying to catch up. If you ever heard of growing pains, that's what growing pains are. It's the muscle literally stretching to try to catch up to the bones that grow a lot as we go through puberty. So what can happen is if your quadricep muscle is very tight, which it can be because your leg grew very quickly, then it's gonna pull on that patellar tendon, which is gonna create traction and pain at that tibial tuberosity, which is the definition of Osgood-Schlatter disease. Interestingly, about 20 to 30% of people who suffer from the disease have it in both legs. The other 70 to 80% only experience it in one leg. So next I want to talk about the symptoms and how we diagnose Osgood-Schlatter disease. So symptoms are typically pain in that area, like I was talking about, right where the tibial tuberosity is, that are made worse with rapid stretching or shortening or any sort of contraction of the quadriceps muscle. Because if the quadriceps pulls, it's going to pull and traction that area that is irritated. So the most common sport that we see Osgood-Schlatter disease in athletes in is basketball, because there's a lot of sprinting and jumping on hard surfaces. We're getting those rapid contractions of I'm bending my knee a lot and I'm going up as fast as I can, and that's just stressing that area. You'll typically see athletes who suffer from Osgood-Schlatter having limited flexibility in that quadricep. Like I said, 20 to 30% of people have it on both sides, but 70 to 80% have it only on one side. So you'll sometimes see a dramatic difference in flexibility in one leg versus the other, and that can be a cause of the stress in one side versus the other. Another symptom you'll sometimes see can be swelling at that tibial tuberosity if there's a lot of traction, a lot of inflammation there. Swelling does not always occur, but it can, and there can actually be bony growth in that area where you'll have a bigger tibial tuberosity, because when our body feels stress, we lay down tissue, in this case bone, from the stress to try to protect ourselves. Now, even once the Osgood-Schlatter disease is treated and there's no more pain and you grow out of it, you may still have more bone on that side, and that's not a problem if it doesn't cause you issues. It's not something to be concerned about. When we're trying to diagnose Osgood-Schlatter disease, we're usually looking at symptoms of when does it hurt? Does it hurt with jumping? Does it hurt with squatting? Does it hurt if I stretch you? Are you very inflexible? Have you grown a lot lately? Do you have, growth pains elsewhere? Are your calves really tight as well? Do you play a sport like basketball that predisposes you to that? And then we can look at x-rays in the area to see if there's what we call an avulsion fracture. That's a severe case where the patellar tendon was so tight that it pulled part of the bone of your tibial tuberosity off of the rest of it. Now that's an extreme case that obviously requires a lot of rest and rehab and everything like that. Usually we're not going to see things like that. You'll typically just see inflammation in the area. Sometimes you'll use an ultrasound or an MRI to really see that inflammation and make sure that the structures are okay in the area. So next I want to talk about how we actually treat Osgood-Schlatter disease here at Eclipse Wellness and in most other places. Typically, surgery or injections are not really required for this. It's more about conservative treatment with physical therapy, rest, modification of activities, things like that. The big thing is trying to figure out what triggers your pain. So if you have a lot of pain when playing basketball, it may require you to decrease how much basketball you're playing temporarily for some relative rest to give yourself a bit of a break as you start to build up and get stronger and get more flexible. It's really looking at the individual to see. As I mentioned, flexibility is usually key in that area. Some of that can just be time of your muscles taking time to stretch out as you grow, as most cases of Osgood-Schlatter will eventually resolve on their own as you grow out of it. But physical therapy can typically expedite things to get you moving better, get you moving sooner, and get you out of pain and back to playing your sport or whatever it is you like to do. Any sort of modality or manual therapy that can loosen up the quadriceps is helpful. So dry needling is something, we typically use for that, if appropriate, cupping, scraping, massage, anything like that that's hands-on treatment that can help that quad relax and help it move a little bit easier. You should also be looking at the surrounding areas, such as the hips, the ankle, things like that can take stress off of the knee, because any mobility or strength that we can get for your hips and your ankle that can take stress off of your knee, when that's running, jumping, things like that, can help us in the long run and help you get better faster. The big key, as I mentioned before, is modifying your activities. So if basketball is causing you pain, you may need to take a break from that. You may not be able to run as much as you want to. It's going to have to be decreasing that temporarily as you start to stretch and then strengthen the area so that you can build back up to what you're doing. So I want to talk about some exercises that we specifically use to treat Osgood-Schlatter disease in our clients here at Eclipse Wellness. So like I said, the first thing that people typically need is to mobilize and stretch the quad. So you can start by just stretching the quad with basic stretches, eventually moving to your hip flexor and other areas that are going to be a little bit more aggressive, but provide better results and kind of replicate more specific positions you may be achieving in sports, whether that's sprinting, jumping, things like that are putting you into extension, that are putting a lot of stress in the area. The next thing you want to start to do, and you'll do this in conjunction with stretching, is to get the quad stronger. Because a stronger muscle can be a looser muscle because it can allow it to relax and absorb more force without tightening up. What I always tell people is, imagine that I had you bicep curl 300 pounds. Your muscles are going to feel very tight after that because they're not able to handle that load. Now, if your quad gets stronger and can handle more jumps and more wear and tear and running, then it's going to be able to relax a little bit and decrease stress that you're feeling in that area, the Osgood-Schlatter, in the patellar tendon and the tibial tuberosity. Finally, you want to make sure you get back to plyometric exercises, which is force absorption and creation, whether that's jumping, running, cutting, things like that in a physical therapy environment, because you don't want the first time you jump or quickly squat or quickly cut to be out on the court where you don't know if you're going to hold up, how you're going to move, things like that. You should be gradually loading those things as you're stronger, as you're getting ready to get back to sport, because the big mistake we make is not gradually introducing stress. We say, okay, we're going to do some exercise and physical therapy. Now you're ready to go back on the court. That's not usually the case. You need to gradually introduce jumping, running, things like that to load the tendon and not irritate it. So what I'm going to include in this playlist are each of the individual exercises in order that I like to use with my athletes. So I'll put them separately so you can take a look and see what works and what doesn't work for you and give them a try. Now, I will say, if you do feel pain or anything in the front of your knee, and especially in these exercises, you should go see a healthcare professional, because while I said Osgood-Schlatter, we typically grow out of it, it is something that you want to be careful about, especially in younger people. Pain is not normal. It's not something you should be feeling, and you want a healthcare professional to take a look, kind of tell you what's going on, make sure everything's okay, make sure you're not missing any red flags or anything like that. If you're in the Northern Virginia area, here at Eclipse Wellness in Sterling, Virginia, we see a lot of young athletes. We deal with a lot of knee pain, things like that. So we're experts in dealing with Osgood-Schlatter disease. So if you're in this area, feel free to reach out. We'll set up an assessment. We'll kind of figure out what's going on. If that is the issue, you kind of know how to treat it already, and we'll just follow along that plan. But let's make sure there's not anything else that we're missing. If you have any questions, comment down below. Let me know. I hope you guys found this helpful. Thanks.